Hello everyone, we're here with Bleaching 101 with Katie. Say hi, Katie.
Hi.
Katie's doing Invisalign with us, and we're actually switching trays every 3 days, and today we're going to show you a video how to bleach your teeth using your Invisalign trays. So Katie, let me see that you have your trays on. Smile. Beautiful smile. So go ahead and take off your trays, and we're going to walk you through this. We've had enough people ask us how to do this properly. Finally, me and Katie said, you know what, we're going to make a video, and we're doing it. She said, oh, you're staying late after work? We're making a video. So here's the trays over here. We use Opalescence 35% bleaching tray. There it is right over here. You're going to go and you're going to break off the small little cap on the tip. There we go. And that cap is very important, so don't lose it. So then what Katie's going to do is she's going to take a Q-tip and dry out the trays. She's so eager to brush her teeth. She'll do that in a second. You want to make sure the trays are nice and dry, so there's no moisture, no water over there. Sometimes it's best just to rinse them under water as well, but Katie keeps her teeth so clean that she does not need to do that. Get it nice and clean. There we go. There we go. And then the other one as well. She's going to get it nice and dry. We don't want any moisture over there because that moisture is going to bring the gel out of the trays onto your gums, and that's what's going to give you that little bleaching zinger sensation as well as make your gums a little white. Okay, the next thing Katie's going to do, she's going to brush your teeth. Oh, you're actually brushing your teeth. Check it out. Oh, yeah. We don't mess around with oral health care here. There we go, and she's going to floss. There we go. We want everything to be cleaned off of your teeth. We don't want there to be any food particles or anything left on the teeth. Also important while Katie is flossing, let's look at her flossing technique. Nice, wrap the floss, Katie, wrap the floss. There we go. And after Katie's going to floss, I'll walk you through what to do next. But it's important that while you're bleaching your teeth, you also are aware of the foods that you're drinking and eating. Try to stay away from any dark staining liquids and foods, coffee, tea, chocolate, wine, pretty much all the good stuff. If it's good, you need to think about eating it while bleaching. Not necessarily during the whole time, but at least within about an hour or so of bleaching. At least that's what I do, and it works great for me and for our patients over here. So after Katie's done flossing, the next thing she's going to do is she's going to take and she's going to go ahead and put a little bit of bleach in the trays. Now remember, only put bleach in the teeth that you want to bleach. Nobody really cares about your second molars all the way in the back. Don't waste your gel over there. So look at where you're smiling, match it up, and look at how Katie's doing. She's putting literally the smallest amount, and then she's breaking it off, and then she's moving to the next. You can see it's a very small amount. And then go ahead and just do the rest of them. So you can see her technique. She's just squeezing and breaking it off on the tray. There we go. And just keep on going, Katie. She's quick.
I've done this before.
Once or twice. There you go. And then she's going to take a tissue, and she's going to, actually before do that, Katie, why don't you pull back on the little plunger over there and show what that looks like. That's so the gel doesn't continue to come out. You pull back a little bit on it, and then you use the cap that you broke off, and the back side of it actually is how it closes. There we go. And now Katie's going to use a Kleenex and dry her teeth. We don't want there to be a lot of moisture. Get it nice and dry. And then she's going to stay open without closing her lip over that. Put in the tray. And then squeeze on the tray with your fingers. And if you're doing top and bottom, you kind of bite into it a little bit. So that way the gel comes out. And then you use another Q-tip or a Kleenex and you go along the gums. And you clean up the extra because a little bit of the gel is going to come out. And that's going to keep from that gel from causing some sensitivity on the gums. Once that's done, Katie's going to take out her phone. She's going to set an alarm for 15 minutes. After 15 minutes, she's going to set an alarm for another 10 minutes if she feels comfortable. I don't recommend going more than 30 minutes. Thank you for the demonstration, Katie. Any final thoughts?
No.
Great.
I'm happy.
Thank you. And happy patients means a happy office. Thank you, Katie.